demonstrate through setting up and preparing equipment for a blood pressure task, which isn't for necessarily all colleges and all AOs, but is applicable to some universities and some diploma students. So it's just to kind of give you a bit of an awareness of what to maybe expect. So you'll have a client with a kitty cat in a basket. Obviously, I'm just putting everything stuff. So you'll have a client to talk to. So for the purpose of this, I'm going to pretend I'm talking to a client, and I'm going to talk to this wall momentarily. So I would start by greeting them, and obviously using their name. So in my task scenario here that we've created here at PJ, we've created a patient called Bob Champion. So I'm going to say, hello, is that Mrs. Champion? And do you have Bob? And hopefully they would say yes, because otherwise that would be a bit of a problem. And I'm going to introduce myself. So my name is Jackie, I'm one of the student nurses, and I'll be setting up for a blood pressure test today. So just to let you know what that is basically where we're going to clip a tiny patch of hair just underneath here around the carpal pulse. We're looking to just take basically a circulating volume of blood pressure really, and we do that by putting a little cuff around his leg, and we will then inflate that cuff and we'll listen for the pulse, and when the pulse comes back versus quietens off, we'll be able to hear as and when we are and then gain our overall reading. So it's not too manipulative, we don't have to hold him too uncomfortable, but we do just have to make sure we're able to gain access to that front leg. So I'm going to kindly take Bob from you and pop him onto our prepared area for our blood pressure task. So there we go, Bob, there's Bob. Now my preference is to get the reading of the pressure of your cuff straight away. So I am just going to take Bob out nice and gently. Hello Bob. Here we are. So you'll be provided with either a tape measure, it just varies, which you can use directly to measure the centimetre size, or you'll be provided with a BP cuff. There are many variations, we've kindly got some from Burton's, but either or that you have. I'm going to suggest that we take it from the left leg, so I'm going to gently measure Bob's left leg here. Blood pressure cuffs are really nice and easy to use, as are the tape measures. They're very straightforward. And Bob is 9 centimetres and a size 3. Excellent. So I'm going to nicely pop Bob back in here now, because I don't want to risk him, watch your head Bob, hurting himself or trying to escape off the table while I prepare the other equipment here. So now I know what size I need. I'm going to gather a cuff, which is relevant to the one I've selected, so I've selected size 3. I need my sphygmomanometer, and I need to check that my cuff is inflating and is actually able to stay inflated so that I can obviously do my blood pressure reading. And I'm happy that that's doing so, so I'm going to release that now so it's ready to attach. I'm going to need clippers, which we don't sadly have power, but I would turn them on. Oh, actually, they're the battery charged, I tell a lie. It's because they're not plugged in, it made me think. So I'm going to turn them on, snap it down, turn them off. I'm going to grab us some lube. And then I'm also going to check that I've got a working Doppler, and that my Doppler works and is all ready, which it does. Excellent. So I've got my kit that we need there, all good to go. I'm also going to prepare a quiet please sign so that people leave us alone, because we're about to do a blood pressure reading. And then the last thing I'm going to do for a second is I'm just going to fill in my blood pressure evaluation form with a preparation of what we're going to be doing. So I shall do that now with my details here of Bob. I will have him in sternal. I will be using the left forelimb. Size of cuff 3. Okay, so that's that ready to go. Now we're going to be obviously looking at taking the blood pressure reading, so I'm going to pop on some PPE. And I've got my sheet and my form all good to go. And then I'm going to come around here, but for the purpose of the video I'll stay this side, but I would go around to the other side so my equipment was ready for my assistant. But for the purpose of the video I'll stay this side just so that you can actually see me. So we're going to come back to Bob. He's been patiently waiting for us to be ready. I'm going to take Bob out gently again. And I'm going to demonstrate how I would restrain him for this blood pressure reading. So again, it's a blood pressure reading, it's not a blood sample. I'm not looking to be too savage or too vicious here with Bob today. Wanting to be nice and relaxed as possible. I'm going to let him sit how he feels, which is generally sternal for most cats. Slightly extend that left leg ready, and I'm just going to support the chest but not over manipulating the head, because we don't want him to be too miserable or angry at us doing this blood pressure reading. And now I'm happy I've demonstrated this. Now, for the purpose of this, I'm just going to pop Bob back, because I don't actually have an assistant ready yet, and I don't want to leave Bob, again, unsafe at any point, that he can just run off of the table because he is conscious, and put my PPE in the bin.